Awareness of human rights is crucial not only for protecting the dignity and rights of those infected with HIV and AIDS, but also for reducing the vulnerability of the wider population. Concerns have been raised regarding human rights violations that individuals with HIV may face. Local stakeholders and international agencies continue to work together in the ongoing effort to address the epidemic.
The world can end AIDS if everyone's rights are protected. With human rights at the center and communities in the lead, the world can end AIDS as a public health threat by 2030. The awareness of human rights is crucial, not only to protecting the rights and dignity of those infected and affected by HIV and AIDS, but also to reducing the vulnerability of all individuals. Human rights can determine the degree to which individuals are protected from HIV infection.
Dr. Gejada emphasized the legal protections in place to help citizens access healthcare solutions to combat HIV and AIDS. She urges the public to avoid discriminating against those living with HIV, pointing out that such stigmatization has had a harmful impact on global efforts to reduce the spread of the virus.
Under international human rights laws and treaties, every person has a right to health and to access HIV and other healthcare services. Stigma and discrimination based on health status, including HIV, are human rights violations. Many people continue to face human rights-related barriers to essential HIV and other healthcare services. The persons facing those barriers are often the most marginalized, stigmatized, and vulnerable to HIV.
Dr. Gejada highlighted a crucial initiative that allows individuals with HIV to have children without passing the virus to their offspring, citing a significant act that aims to address this concern.
Discrimination of people living with HIV has deprived them of basic human rights that other people, including other patients, enjoy. St. Lucia has been a member of the United Nations General Assembly since September 18, 1979. Article 16.1 states that everyone has the right to marry and found a family. All persons living with HIV have the right to have children, and in St. Lucia, medication is available that women living with HIV who are pregnant can take to reduce the risk of transmitting the virus.
She further discussed the efforts by St. Lucia's healthcare system to reduce the local HIV epidemic and provided key statistics to keep citizens informed about the current state of HIV/AIDS on island. Dr. Gejada encouraged citizens to get tested regularly, especially if engaging in unprotected sex, and reminded them to make use of the resources available to manage the virus.
St. Lucia has available comprehensive treatment, care, and support, which includes access to antiretroviral therapy and other medicines, diagnostics, and treatment for related opportunistic infections. Currently, there are just under 1,000 persons living with HIV in St. Lucia. Of those persons, only 284 are actively collecting their antiretroviral medication. Those 1,000 are the known diagnosed cases of HIV.
By ensuring equity in healthcare access and eliminating stigma and discrimination, Dr. Gejada believes that St. Lucia can work towards an AIDS-free future. For the DBS News World, Manasseh Stanislas reporting.